So my name is Juan Herrera. I work at EPCC as an applications consultant, and I'm involved in the Archer 2 service, that is the national supercomputing service in UK.
How is EPCC working to solve the COVID-19 problem?
Yes, so EPCC is involved in several COVID-19 research activities. EPCC provides the computing and storage infrastructure and expertise for the safer processing of data. Regarding computer, we host Archer, that is the national HPC service in the UK, and Cirrus, that is a tier 2 supercomputer systems. Both of them are used by several projects in order to do research in this topic. Archer features a high priority queue, and also the COVID-19 grant applications go through a fast track process. It's not just a case of HPC, but having an HPC and data science systems that have been built as trusted research environments, suitable for the secure collaboration and analysis of clinical health and genomic data sets.
Do you have any examples of projects that are leading this research?
Yes, one of the projects is called RAMP. For example, that is the RAMP is a rapid assistance in modeling the pandemic initiative that is supported by Professor Mike Cates and the RAMP steering committee. And this project was convened by the Royal Society in the UK to enhance 16 COVID-19 initiatives. Also, we have the National Safe Haven is used by different entities. For example, has been key to our work with the new Global Open Finance Center of Excellence, partnering with a major UK financial institution and local financial technologies on modeling the economic consequences of the pandemic. Also, we have another project is called Datalog. Datalog is a repository of all routine health and social care data for the Edinburgh and Southeast Scotland region that is designed to help find solutions to current health and social care challenges. EPCC data scientists have been working with the User Institute and NHS Lothian colleagues. NHS stands for National Health Service in the Datalog project to help create a multi-source COVID-19 data set for the Lothian region.
Awesome, thank you. That sounds really cool. I haven't actually come across yet any projects that are focusing on the economic impact of COVID-19. So that's a really interesting subject that you're touching on. As you have groups that are working on projects that are new and unprecedented at EPCC in terms of the COVID-19 research, can you touch on how HPC has enabled and accelerated COVID-19 research?
Yes, because HPC is one of the key technologies helping to fight the global coronavirus pandemic. Mentioned before, for example, European projects such as BioXcel, HeckBioSim, and CompuBiomed are using HPC facilities like Archer or Cirrus to analyze the origin and structure of the SARS-CoV-2 genome. Also, I have an example of a project where HPC was key. That following a request from Professor Mark Bullhouse, that is a member of SAGE, for compute time to model infection and death rates, we provide access on our Catalyst ARM HPC system to the PDRA who was doing the work. The code was struggling with insufficient memory and poor parallelization. What we have done is we fixed the code, bringing its parallelization up to date, and it was used on almost the entire 4,000 core system throughout July. This work allowed the researcher to move from doing 100 simulations in about 12 hours to doing around 3,000 simulations in roughly 3 hours. So this is roughly 30 times more work in a quarter of time.
As we are in a pandemic, the sharing of knowledge and collaboration is probably more important than ever. What initiatives are you involved in to help accelerate and advance COVID-19 research?
So, for example, regarding data, there is an initiative with the Scottish. Since the start of April, the Scottish National Safe Haven team, led by the Electronic Data Research and Innovation Service, which is part of the Public Health Scotland, has been working closely with us, with EPCC. We provide the National Safe Haven infrastructure, and colleagues in Scottish Government, including the National Records Scotland and NHS Scotland, to develop a COVID-19 research database, bringing together data sets from across the Scots public sector to answer questions posed by the research community and Scottish government officials. So having that resource of data will help researchers to investigate further and get make more progress in the COVID-19 research. Because as I mentioned before, it's not only HPC, it's only to provide the data to work with and provide that data in a secure environment, like the National Safe Haven.